Repair England and the Centre for Ageing Better. It's a great pleasure for me. My name is Chris Phillipson, and I'm one of the co-directors of MICRA. And the theme of our session today is lockdown in poor housing, health impacts on older people and successful responses. And I think just to say a few words before we start, I think there's no doubt that the pandemic has brought out the importance of poor quality housing in the way that it affects older people, and the need to really ramp up changes in housing provision for older people. We are faced with a situation where we have 4.3 million homes defined technically as non-decent, half of which are lived in by people over 55. So this is a really serious set of issues. And of course, the questions have had even bigger impact given the issues raised by COVID-19, overcrowded housing, people living in damp accommodation. All of those things have really become even more serious in their implications for those affected. Well, we have had, I think, a number of important reports on this theme, produced by Care and Repair, the Centre for Ageing Better, and indeed other organisations. I think this has been a good response, actually, by different organisations in recognising the urgency of this. And I'm delighted that we have a terrific panel who are going to address this issue. We have three members of the panel. Firstly, Sue Adams, who is Chief Executive of Care and Repair England, a national charity established in 1986. And Sue, of course, has been really at the forefront of tackling issues related to housing, poor housing, particularly as it applies to older people. And she's really been leading many of the debates and a very forceful presence on a number of national committees on this topic. The second presentation will be from Millie Brown. Millie works for the Centre for Ageing Better. And the Centre for Ageing Better, funded with support from the big lottery, have, I think, again, played a leadership role in putting the question of housing to the fore. And Millie herself has had extensive experience in the field of housing, and will talk about some of the recent research from the centre. And finally, Craig Smith, who's Chief Executive from Care and Repair in Preston. And Craig has been responsible for developing a range of very innovative schemes in the Preston area. He's going to talk about some of the practical responses we can make in this really important field. So I'm going to turn over to Sue first of all, and Sue is going to sketch out the broad picture for us in relation to the issues surrounding older people, poor housing and health. So Sue, if I can turn over to you.
Thank you very much, Chris, for that opening introduction. Well, I'm going to set the scene here. Next slide, please. As Chris just mentioned, next slide, please. We're a small charity that's been around since 1986, and we don't run local care and repair schemes. They're all standalone independents. But what we have tried to do is spread the message, the urgency of tackling poor housing for ageing. It's not that all ages don't matter, but there are particular health connections, which I hope I'll now be able to illustrate. So next slide, please. Just to mention that where I've shown a report in these slides, which will be available later, I've embedded a hyperlink to them. So it's really not just us. We've got a worldwide World Health Organization statement with very useful evidence base, which underpins their housing and health guidelines. And it states absolutely that if you improve housing conditions, you save lives, prevent disease, increase quality of life, reduce poverty, and mitigate climate change. And I will come back to that climate change, health and housing connection. Next slide, please. So World Health Organization starting big, and then we start to bring it down to England, because England has this measure, this system of a national survey called the English Housing Survey, which is underpinned by evidence around the housing health connection and being able to measure these relative risks and health impacts. And the Building Research Establishment are the people who undertake this. And their analysis of the cost to the NHS of poor housing, and this will have gone up undoubtedly, is 1.4 billion per annum. And that is just first year treatment costs alone. And as you'll see, a lot of these housing and health connections, there are year-on-year costs. So next slide. We then worked with the BRE to take that national data and mine it for, well, what does that translate if you look at the age of the people in those non-decent homes and the health costs? And as you see, it's just under half of that cost to the NHS is for the older people who are living in around half of that non-decent housing. And this is particularly important as that older population have the most long-term health conditions. And as you age, there are more calls on the NHS. Next slide, please. Then we start to narrow that down further and look at what are the regional variations here. Now, there is a bit of an issue with the sample size of the English Housing Survey nowadays, because it's difficult to mine it to a locality level. But the Northern Housing Consortium and the Smith Institute took the cost of poor housing in the north and did mine that data and came up with a very useful report, which I would commend to you. But I suppose they discovered what we've been saying for 30 years, which was the people who are the most badly affected and the ones who, if you like, cost the NHS the most are older homeowners. They are the most likely occupants of poor housing. And I think, we can see that the cost of poor housing and the health conditions, there is such a strong connection there between inequalities, the age of the housing stock, the quality of the housing stock, and this terrible term of left behind areas and a north-south divide, which I'll come on to. Next slide, please. The most recent report, which has looked at this housing health condition, I very much welcome this. It was done by the King's Fund, because one of the problems that you have with getting a response at a policy level, and there's been very little, is engaging with the NHS and the health sector to get across this importance of housing. And people like Marmot and the public health will get it. But the health world does listen to the King's Fund. And I think what's really important here, older people have been hugely disproportionately affected by COVID. 90% of the deaths are the older population. But what this says is that the pandemic has exposed and amplified those housing-related health inequalities. And I think on so many levels, what it's revealed to a younger age group is the dire circumstances of a lot of older people, especially when it comes to isolation, loneliness, and confinement to home. All generations have had to experience what a lot of older people live with all the time. And the other connection is saying that the groups more likely to live in poor housing are those same groups who are the most vulnerable to COVID, the older people and those with long-term health conditions. So all that data and all those reports that I've highlighted there are very relevant to our post-COVID response. So next slide, please. So I just want to move on to now looking at some of that key data and mining that further. Next slide, please. So let's be realistic about what we mean. This is a very simplified list of how we measure health impacts and how it underpins what's called the Housing Health and Safety Rating Scheme, which is one of the aspects of defining a non-decent home. And so the long-term conditions that are particularly prevalent in later life are respiratory conditions, COPD, rheumatism, arthritis, huge proportion, that's exacerbated by a cold home, cardiovascular disease, you've got measurable impacts there if you live in substandard housing. The mental health impacts, I think these might come out quite a lot with Millie, but we've certainly seen a huge increase in the extent to which people are talking about the mental health impacts of their housing. on all sorts of levels, the stress, isolation, depression, and there are measurable impacts there. And then there's the risk element. So you've got the causality and the exacerbation, and then you increase risk. And particularly for an older population, that one at the top of the list is the really big number ticket of increased risk of falls if you live in poor or substandard housing. Next slide, please. So those are the conditions which we then measure the NHS costs for. Chris has mentioned around 10 million people living in a non-decent home. This is a piece of work that I did in partnership with Centre for Ageing Better and the Building Research Establishment again, which mined the data, because government doesn't mine the English Housing Survey data for health and ageing. So other parties can have to access that data and do this. And so the main reasons that homes are non-decent are hazards to health and the falls risk and the cold risk. You've got 2 million older households in non-decent homes, but we've got no policy and no funding since 2010. So we really need to catch up on this one. There were policies and funding from 1945 to 2010, and we have none at the moment. So this is an area that absolutely post-COVID needs some urgent action. Next slide, please. So that's summarising the 4.3 million, 10 million, the 2 million, and I think the really important one, nearly 1 in 5 of households with a long-term health condition or disability of all ages lives in a non-decent home. We're back to that connection with the COVID risk and infection risk. Next slide. Okay, so it's okay. Could we go back? You skipped one there. Thank you. Could you go back one? When you want to look at the data and you want to come up with solutions that work, we've now got the data. This is where the non-decent homes are. This is the age profile of the people who live in those homes. But what you need to look at is what's the tenure of those homes? Now, most of the activity and the conversations are about improving social housing. Very important. I mean, we've certainly got a terrible shortage of social housing, but the reality is the best quality housing is the social housing stock we have because of the major investment under the Decent Homes programme. And the real concentration, both the older population and all ages, of non-decent homes is in the owner-occupied sector, for which we have no real solutions. You know, just give you a little story from just yesterday. This isn't an older person, you know, a woman separated home, a little house, not very worth a great deal, 3 children, 2 disabled. The electrics go wrong. You know, no money, no savings, barely keeping a head above water. And fortunately, there is a HomeWise scheme that could help us sort the electrics and had a hardship fund. But our current system, our state system, has no way to help that person. And if that all collapses, the cost to the state of 3 children in care and so on is phenomenal. And if we carry on doing nothing about this sector, we're storing up problems. Next slide, please. So then we also start to look at if we want to correlate housing and health. As people age, so the over 75s, the over 85s, the NHS calls fairly logically keep going up. And when we looked at the English Housing Survey data, the actual number, it's not necessarily a proportion, but the number of over 75s living in non-decent homes, even I was shocked by this, had gone up by 31%. And we're seeing signs in certain sectors of conditions going downhill. Next slide, please. Now this is, if you can just about see it, I think this visually shows you how important tackling cold homes and falls is. So there might be lots of schemes that are very important for other hazards in the home, but the really big number items are cold. And if you add up the 3 falls, well, there are 4 falls hazards there. And if you add all those, they exceed the cold homes risk. So if you wanted a coherent national programme to tackle non-decent homes, if you tackle cold homes and falls risks, you will remove most Cat 1 hazards, which are, you know, an immediate risk to the health and safety of the occupant of the home. Next slide, please. So this is to illustrate how important it is that we reduce falls, particularly amongst our ageing population. And again, COVID, restriction to home, we've had loss of muscle tone, and so people are going to be even more likely to fall once they start going out again or moving around the home. So half of hospital admissions pre-COVID This is non-elective admissions for accidental injury or falls in the home being the vast majority. They're responsible for a high number of ambulance call-outs. And one of the main killers of older people is hip fracture. You know, I hate to say this, but not that many people survive after a hip fracture, and they're hugely costly. And if you do survive, that tends to be the point at which your care needs start to escalate. So the more that we can do to reduce this risk, the better. And we can do this by doing things to the home, as well as the exercise programs, the drugs programs. Next slide, please. So the next hazard that I mentioned was cold. And I think this is where we'll be missing a trick if our initiatives to improve, to tackle our existing housing stock and the carbon reduction agenda doesn't also take on fuel poverty and the other hazards in the home. You know, they've got to have a whole package of insulation as well as the heating improvement, and let's go in and tackle the falls risks at the same time. So next slide, please. Next one, thank you. So why do we need to do existing homes? I think I'm totally supportive of all the impetus, and we've support every campaign going to improve the design of new homes so that they're future-proof, they're accessible, they're well-designed, they're energy efficient. The reality is 80% of the homes we'll be living in by 2050 are already built. There's lots of noise, if you like, about how important it is to build lots of specialist extra care and retirement housing. Yeah, it's a great niche one. 96% of us as we're old will live in ordinary housing, 4% in the specialist stock. So that's where the reality of where people live. It's actually where most people want to live. There's, you know, despite all this, there's an incredibly high level of satisfaction with the current home amongst the older population. So 94% of people over 50 households, they say they're satisfied with where they live. And I think we also have to be realistic that a high proportion of disadvantaged groups have no choice. If you're at the bottom of the housing ladder, you might want to stay there, but you can't buy anything else with the value of what you've got. This is where the north-south divide is so stark, because most of the expensive retirement housing, apart from, you know, if you float off to the rich bits of the north, like, you know, the Harrogates, the Chesters, they'll have retirement housing, but you're not going to get that in poorer places. It simply doesn't make economic sense. And so often, a lot of people have no choice. Next slide, please. We'll skip that one. I've mentioned that already. Thank you. Next slide. We're now starting to see more conversation about COVID has exposed the huge inequalities in our society, and Marmot has done some excellent recent work on this. And this is also important when it comes to housing. If you live in a terraced house in Oldham, well, you know, somewhere else, it's a world apart from perhaps living in physically the same sort of design of house in Barnes and Richmond. And the solutions to non-decent homes have to be different. You can't just keep saying use housing equity. Your place is worth $1 million when it's worth next to nothing. Yeah, we've got to have tailored solutions for the north. Next slide, please. I'm going to speed up a bit here. I've got 2 minutes. And just to really bring this home, I think the healthy life expectancy and life expectancy, we're going to see this. This will have been exacerbated undoubtedly by COVID. And you know, I think this is a national scandal. I mean, we're not far off a 20-year difference in healthy life expectancy between the best off and the worst off. And, you know, it's not far short of 9-10 years for actual life expectancy. And there is undoubtedly a neighbourhood connection to this. Next slide, please. And if we tackle homes, we will actually help to reduce that. It's not the total solution. There's no magic bullet, but it's important. So potential solutions in my last 2 minutes. I've mentioned carbon reduction retrofit plans. This is such an opportunity to remove other Cat 1 hazards and make homes safer places as well as warmer places. The north, I mean, we've heard the mayors talking about job creation. We've heard all this talk about levelling up, but here's a huge opportunity to train a workforce, because we've got a huge skills gap, to improve our existing housing stock. We've got an information gap as how you target interventions between the people with the worst health issues. We've got digital health now. I just threw this one in, but we could be measuring like a cold home and then have a linked intervention. Next slide, please. So Cat 1 hazard. So falls, I think there are some opportunities coming up. I think health gets falls. they want to do everything that they possibly can. So anticipatory care, falls prevention pathways, I think there's real opportunities here. But we've got to have the people who can deliver the solutions. And you are going to hear from Craig from Preston Care and Repair, who actually covers nearly half of Lancashire, actually. But, you know, safe at home assessment, but it's got to come with remedial measures. I see all these home safety checks, but who's going to go in and do the work? Where are we going to get the handy person services to do the small jobs? There's fantastic good examples of fast tracking adaptations, but it's not being taken up everywhere. We know what to do. And essential repairs for health assistants, we've got great examples in Manchester. We need to roll this out. Info and advice for self-funders. The state isn't paying for all of this, but people need some help to do what's needed. And awareness training, future-proofing your home, I think would be a really useful part of future services. So next slide, last slide. So thank you for listening, and I hope we can all work together to make a difference. Thanks.
That was terrific. Thanks very much, Sue. And these slides, just to confirm, will be made available afterwards. There'll also be a YouTube recording. If you could save your comments and put them in the chat function, we'll pick them up after all of the presentations. But Sue, that was terrific, and I think bringing out the mental health consequences of poor housing, as well as the physical health, I think is really important. And I think the mental health side has certainly come across in the context of COVID-19. We now go on to Millie Brown from Centre for Aging Better, and Millie's going to move us towards the experiential side in terms of the impact of poor quality homes, reflecting on results, I think, Millie, from an Ipsos Mori survey, which has been supported. So over to you, Millie. Thanks very much.
Thank you, Chris. Hi, so as Chris said, I'm here for the Centre for Aging Better. First of all, to let you know, we're a charitable foundation funded by the National Lottery Community Fund. Our aim is for everyone to enjoy a good later life, and therefore we create change in policy and practice informed by evidence and work with partners across England. Just to say, this work is part of the Good Home Inquiry we have recently commissioned. It's an independent inquiry, and the aim of it is to establish why so many of England's homes are in poor condition, as well as exploring what we need in the good home. We're trying to change the narrative to make people think about what they want out of a good home, rather than resisting to call themselves their homes poor quality. So the work I'm here to talk to you today, we commissioned with Ipsos Mori. It's a second part of the Good Home Inquiry. The first was actually a report with the King's Fund about homes, health and COVID, and I would encourage you to look at that as well. Some really good stuff, but unfortunately haven't got time for that today. So as I said, the work here today is looking at the experiences of people 50 to 70 who live in poor quality homes, and this research was undertook with this year, so within the pandemic, when people are obviously spending even more time at home than ever. Next slide, please. Thank you. So, as I said, it's commissioned with Ipsos Mori. Whilst we wanted to look at people's experiences of their homes at 50 to 70, the actual questions were, so what is the relationship people have with their home when approaching later life? Do they see it positively, negatively? Does that change as they age? We also wanted to look at the impact of the problems they have with their home and their health, their well-being, financial security and social connections. And finally, we wanted to understand more about their ability to access help and support to improve their living situation. And included in this, it's the barriers they face accessing that support and making changes to their home. As I said, participants were aged between 50 and 70. They were recruited from across England. The sample was purposely a diverse mix of gender, ethnicity, socioeconomic group, housing tenure, living situation and type of home. It's because we wanted to get the experiences across the board and make sure that we weren't just channeling on one kind of person. But overall, everyone did live in a home that did not meet their needs and would be viewed as poor quality. This is a longitudinal piece of research, and the purpose of that is we found, and I think as many assume that, as Sue said, most people have a high level of satisfaction in their home, and they almost don't want to see the issues within it and accept the issues within it. And that's why we wanted to take these participants on a journey. At first, that was just kind of understanding more about them, warming them up. And then we did, as it was all online, an app life with Ipsos Mori, a great piece of technology where they kind of took us around their home, they recorded, they showed us the issues, and then we discussed them with it. And I think one of the most important things out of this research is, whilst it was only 20 people, we actually changed their perspective on their home. Yes, they still loved their homes, but actually by the end of it, they recognised something needed to change. And I think that's something that we all need to remember when we're working with people. A lot of the time, they don't want to make changes because they're happy as it is, they don't want to disrupt it. And that's why this research has really shown we need to give people the time to feel comfortable in that. Okay, next slide, please. So the key findings I will go more into people's understandings, but I felt these are the high level key findings, and unsurprisingly, they'll reflect very much of what Sue said. So, for example, common problems included excessive damp, inability to heat homes properly, poor design, disrepair, which all obviously left people with a greater risk of falls and other injuries as they grow older. Again, as I kind of just mentioned before, emotional attachment really prevented people from being realistic about the problems that exist in their homes. And to move forward and make change, I think behaviour change is a big part of this, and there's still more to be done to understand how we can incite behaviour change in people. Again, part of this, because, and it was all common across all participants, people in this research who were 50 to 70 were reluctant to think ahead. They didn't feel they were old enough to undertake home improvements now. But as we all know, working in this sector, it's not about how old you are, it's about making sure you're safe and you're healthy. And I think, again, this needs to be addressed. So key finding again, when people do recognise a need for repair and adaptations in the home, they can face a range of barriers, mainly finance options, but also actually a lack of support. And I'll go into more detail about that later. But this support includes help recognising what changes they need to make in the home, all the way to who they can actually trust to carry out those works. And because of this lack of support, people were choosing unsafe short-term and unsustainable fixes. So trying to fix fall hazards in their house themselves, which actually sometimes made it more dangerous for them. And finally, as I'm sure everyone here is aware, tenure affects people's options around making home improvements. Renters mainly felt unable to carry out repairs due to the relationship and reliance on their landlords. And again, unsurprisingly for many of us, these landlords, for the participants, were not welcome to the idea of making adaptations. And that in itself is a piece of work that needs to be addressed. How do we either force landlords to do this or just encourage them to see that making adaptations to their homes will not lose value? There are many people who need homes like this, and there's a market for that. Okay, next slide, please. Great, thank you. So here I'm just going to go a bit more into the issues within their home. Things will very much replicate what Sue said, but we'll talk more about how people felt about this. So we had three categories, or three themes, should I say: warm and dry, moving around the home, and a third, safe and secure at home. So unsurprisingly, again, the majority of participants described how cold their homes were, and this was prevalent across all the tenures. However, the reasons for individuals living in cold and damp homes varied. For example, some heating appliances were inefficient or expensive to run. Homes were poorly insulated or had drafty windows. However, whatever the cause, negative impact of living in a cold home on their well-being, their mental health, and their finances was consistent, with one participant sadly stating that they every day felt a trade-off between household finance and living in a cold home, and that made, of course, them miserable and overwhelmed. And I think it's actually important to raise that for many of the participants, it wasn't about the damage to their health, about the issues of being warm and dry, but actually it was an embarrassment. Their mental health suffered more, they believed, than their physical health. I think that talks to what Sue said, that we need to really get to people that link the issues between homes and health, not only for government and for local government, but actually for people themselves. If they can't see the detriment of these issues are having on their home, we can't encourage them to actively change. So secondly was moving around the home. Those with mobility issues were most unsurprisingly most vocal about their concerns of moving around their home safely. However, all participants expressed significant stress and anxiety linked to a fear of injury in the home. So participants spoke of not seriously thinking about how the home would impact them as they aged when they first moved in. So this is the main thing. We're not talking about when you get to that age group of 50 to 70 thinking, oh, because most people don't want to move. So we need to instill in people and drive the consumer demand for accessible and adaptable homes. And one really sad story that brought it to light was there was a social renter whose bathroom was so inaccessible to her that she was actually washing in a kitchen sink or travelling to her family's home to shower. As you can imagine, this was severely affecting her mental health. She actually said to one of the researchers that I deserve the right to wash freely like anybody else. And when you have to wash in the kitchen or rely on family members, why should I have to do that? And the question is exactly, why should she have to do that? And finally, we have safe and secure at home. And this was more about a physical sense of feeling unsafe and secure. So, for example, we had participants whose doors had massive cracks in it, and also the steps up to their homes had become almost unusable and falling apart. And this notion of helplessness concerning physical security was actually exacerbated by a fear of security of tenure for renters. And this linked again about asking for repairs and adaptations. A lot of the people who lived, private renters especially, felt that they were at risk of losing their tenancy if they asked for something simple as a grab rail, which is just no way to live. Okay, next slide, please. Thank you. So I've just kind of run through the issues for you, but a really big part of this research was to understand the barriers people to make change. So as I said, through this research, we got people to think about not only the issues, but actually if they were going to make a change today, how would they do that? And unfortunately, so the biggest narrative was they didn't know what they were going to do next. And with part of that was finances. So across all 10 years, finances were highlighted as the most significant barrier to making repairs and adaptations to the home. However, this was particularly an issue for homeowners. Due to a lack of disposable income for most of our participants, most did not view change as essential, as I mentioned again earlier, and it was instead about prioritising and not future-proofing. And as we know, this will have detrimental effects in the future. And one of the questions raised by one of our participants, is it more important to do this than other things? It's about prioritising. And as we're in this sector, we understand it is important to do this, and it will have major positive effects if we make the changes early on before injuries occur. However, I believe it's about educating people about this. So in terms of overcoming this barrier, grants and loans were viewed as critical to enabling repairs and adaptations for later life. This was the feeling across 10 years. And it's unsurprising, of course, but however, most participants were unaware of existing grant and loan schemes available to them. And as we all know, the Green Homes Grant is in the news ever at the moment, but unsurprised. And this research was undertaken before it had the real negative press, and we use that as an example. Have you heard of this policy? And the overwhelming response was no. Wouldn't know how to even find out more about it. So participants did emphasise financial support should be relatively available to help make their home safer. And they did believe this could be means tested, because we did have one participant who himself said he was wealthier, as in his words, but he actually was more concerned about those who didn't think could afford it. So it's very consensus that we should try and help those who have less financial options available to them. And a very poignant quote is, let people upgrade their homes without making people go bankrupt when they get older. Very to the point, but very what everyone needs to hear, I think. And this barrier of finance was echoed. We actually did some recent additional work, Aging Better, where we commissioned a survey with NatSen looking at people's experience of lockdown across all of our key goals. However, we did do some about housing. And over 2/3 of people aged 50 to 59 said that cost was the main barrier to making change to their homes. So undeniable. Next slide, please. And the second barrier that was in all of the participants we worked with was access to support. So this lack of support went from identifying problems to hiring tradespeople to carry out repairs. And this barrier for most was actually just as big as barrier of lack of finance options. So the need for support in identifying problems I've talked about was mirrored by lack of awareness of the impact of certain problems could have on their health. Many told stories of these issues getting progressively worse before they identified something wasn't right. And this lack of awareness combined with a tendency to be optimistic about their health often resulted in delays and inaction. This was irrespective of tenure, and participants shared the view that support involving an expert looking at the problem with you would give them motivation to make changes. And in the case, we felt they looked at us to be those experts while we're not on the ground, and it really did make a difference. One thing we can take from this research, we do hope that, and we will follow up with the people, that they will make changes. So overall, what support do people want? As well as actually identifying problems in their home, people wanted informed decisions to help which finance options are suitable for them. So not only what was available to them, but actually what works best for them. A lot of people had reservations about taking loans later in life, completely understandable, but it was about making sure that someone is there to not make bad decisions and to make that process as easy as possible. And that meant actually submitting an application with them for a grant or a loan. And as I said, support to hiring reputable tradesmen to carry out repairs was also a concern. People they raised concerns that they were worried that tradespeople would rip them off, so to say. And I think that's a narrative throughout all ages. However, they kind of echoed it more because they felt that they were more vulnerable to those issues. Whether that's right or wrong, that's what the participants felt. And as you can see from a quote there, you hear all these stories of bad contractors. It's hard knowing who to trust. And I think one of the ideas that came from it, and I know that Craig will talk more about this, his examples of this, but there was a real desire for a one-stop shop, someone they could go to take them through this process from start to finish. How we can create something like this, I'm not sure, and there are great examples of that throughout the country. However, we need to shine a light on that. Okay, next slide, please.
Just a minute.
Okay, that's fine. That's great. So, conclusions. As you can see here, and I'm sure after you can read more about, but overall, the majority of people have problems that need addressing within their home, whether large or small. People's strong emotional attachment to their homes often leads them to ignore such issues or decide it's a problem for their future self. However, those that do accept the need to make repairs and adaptations, a significant lack of available access to suitable financial options and information and advice. And it's important to recognise that for many of the participants, the realisation and acceptance of problems in their home actually came from taking part in this research. People's sense of home is complex and tied up in so many things beyond bricks and mortar. So future initiatives must not only concentrate on developing mechanisms for support in carrying out repairs and adaptations, but also have the intention of educating and sparking behaviour change at the earliest point. This research did identify a number of external barriers that need to be addressed. And I think overall, these really could help people to live independently, happy and healthy in their homes for longer. And I will finish now, but I just wanted to show the next slide that we are following on continuing with this research by doing a large-scale policy review, and we're holding a deliberative event in the next few months. So I really would encourage you, if you have the time, to look into our website, Good Home Inquiry, and find out more of these events, and hopefully they can encourage you and inspire, and maybe you can get involved. But yeah.
Great plug. Yes, great plug, really. Thanks. Thanks very much. That's terrific. And just a reminder, the slides will be made available afterwards with a recording. We've got some great use of the chat function. We'll come back to that. But I'd like now to go to Craig Smith, who's Chief Executive of Preston Care and repair. And Craig is really going to talk about some of the successful responses that we can see in this area. So, Craig, delighted to hand over to you.
Thank you. So yeah, I'm from Preston Care and Repair, which is obviously based in the north. Next slide, please. We're a home improvement agency that Sue Adams alluded to earlier in her presentation. We were set up in 1993, so almost 28 years old. We started out just covering the Preston area, but we've expanded and we now cover 6 local authority areas. And our primary objective is delivering services to help older, disabled or vulnerable people stay safe, secure, warm in their own homes. Next slide, please. And our vision really, sorry, could we just go back one, please? Yeah, so that's our vision, is keeping people safe in their own homes in a holistic manner. And we do this by, we listen to our customers, we really try and understand what their needs are and deliver the service that meets them and helps them in their own home. Next slide, please. So by doing this, the services that we help people with in their own home, and we're a not-for-profit organisation funded by various sources, and funding has become harder, but we carry out handy person services, so we'll go into people's homes and carry out the small DIY type jobs, and primarily targeted at people over the age of 60 or people with disabilities or over 18 with a long-term health condition. And so the handy person service may be replacing a tap washer, them small jobs that they can't actually get a contractor to come out and carry out. And we deliver those services at a very low cost, either a subsidised hourly rate or often free of labour, and then just charging out the materials, depending on what sort of funding we get from our local authorities or from other sources. We also carry out minor works, which might be more complicated, or slightly larger works, might be over 2 hours work, and we'll always give somebody a quote for those type of works. But again, it's jobs where they're unsure about getting a contractor. We've got the specialism in adaptations. It might be small adaptations that they want, that they can't access from social services or other areas. We also deliver the minor adaptations in 4 areas of Lancashire. So that includes things like the step adaptations, helping them be safe for getting in and out of the homes, putting up stair rails, and working with health and social care around what sort of adaptations to make people safer in the home. We also give advice on larger adaptations and repairs. So if somebody's struggling with their electrics or roofing, we have technical services that we can go out and advise people in the home, and all of that advice is free of charge to customers. And we might help prioritise repairs for them, or they might contact us to say, I've had a quote from a contractor, I'm not sure whether it's genuine. We'll go out and assess that quote with them and give them advice so that they feel confident in the works that they need to be carried out. And we will also design and manage works for people as well, where they want us to carry that out. And so we're quite heavy on the support and advice, and which leads into the healthy homes assessments, which are quite key to quite a lot of the work that we carry out. So we have a caseworker that goes out into the home, meets the customer, sits down with them, goes through what concerns they've got around their home, whether it by slips, trips, falls, it could be heating. But that caseworker is also trained in spotting the undetected, the things that the customer might not say, but we actually feel might become an issue for them. And then we'll signpost to the right areas, often it's services that we can deliver to them, or it might be signposting to local authority schemes. So that's sort of the services that we generally cover. Next slide, please. So in this past 12 months, we've obviously had great challenges with COVID-19. We've had to really assess the sort of works that we can carry out for people and try and keep as much work going as possible. Initially, when the first lockdown came, sort of almost a year ago now, we had to consider what safe working practices and the type of works we have we started to try and define what was essential works and what was non-essential works. Now, that's quite difficult to define for some people, because putting up a curtain rail for one person might not be essential, but actually for another person it could be incredibly essential for their security and warmth. So we took each job on a job-by-job basis. As part of the works, we do a lot of works with social care. We were getting limited referral information from them. So we were having to go out and assess works that the OT may have been assessing previously, but they weren't making customer visits, and develop our working practices. And the customer confidence in what we were doing was key. So we would explain to customers around how we would approach their property. We developed that we would come to the property, make phone calls to the customers when we were outside, saying, could you open the door for us, and then leave to a separate room. We'll come in, carry out our works. We'll wipe down before and after before we start works. We would sanitize after finishing works. We're wearing PPE, gloves, masks, the appropriate PPE to make sure our staff were safe, but also making sure the home was safe whilst we're carrying out the works and after. We had real issues with supply of materials. When the first lockdown hit, we drew the following day a large order of stair rails, flags, cement, sand for our works, for adaptations, for step adaptations, for fitting stair rails, and it just didn't arrive. All the merchants around us shut down, which left us with a real problem about trying to find where we could source materials from. When we source materials from far and wide, and as a small organisation with limited funds, we had to pay excessive prices for materials and for PPE supplies. Whilst we had certain elements of PPE supplies, we didn't have enough for the sort of challenges that COVID presented us. The local authority who we had contracts with did help in certain areas, but we have and continue to have to pay quite high prices for the PPE supplies. But our main aim was to continue delivering those services to the people to make them safe. And really, there'll be a slide later on showing the sort of work that we have carried out for people in numbers. Next slide, please. So this is really a case study of sometimes the sort of works that we might come across. We did receive a referral for minor adaptation for a second stair rail for a 78-year-old lady. When our technician went to site to carry out fitting that stair rail, he noticed when he got to the stairs that it was a bit soft underfoot at the base of the stairs. So he investigated it a bit further and actually found that the floorboards were rotten. And it was, wouldn't have been long before the floorboards would have actually collapsed. It was quite bad. And the customer, she'd actually said, she had noticed it, but didn't know where to turn to, didn't know where to start with the problems. And she'd recently had a new boiler replaced, which we'd actually signposted for under a government scheme, because she was on pension credit and council tax support with limited funds. And I think the contractors there had commented about it, but just left it. They hadn't thought any more of it. So we investigated the damage in the floor, the rotten floor, and understanding that the customer wasn't able to fund any works, and also understanding our caseworker was involved, that we couldn't actually rapidly source any funding from any sources. There was no local authority grant available. It would have taken time to put something in place. So we decided we carry a small funding pot for hardship fund for where there are customers like this, that we can, it's built up of donations that have been given to us from past customers. And we decided we'd commit our labour free of charge to carry out works, and would use the hardship fund to fund the actual repairs, the actual materials. As it turned out, we pulled the carpet further back. The dampness was quite substantial, closer to the wall. So we spent probably a day and a half replacing floorboards, replacing timbers, getting the inside all set up ready. But then it wasn't just an issue of sorting out the inside problem of the floorboards being caused because the wall was damp as well. Is actually looking what is the main cause, why is the wall damp? So we investigated outside and found that there were drains outside that were actually blocked or collapsed. So we dug out a gully and replaced a gully, and that was really the cause. It's been a blocked gully over many years that was having water sitting and seeping through the wall and caused probably the problems over sort of 10 to 15 years. But we were able to do all that, and I think the materials cost around £150 in total, and we had 2 people for 3 days that we had to carry out the works, but it was absolutely vital to that customer to help them live safely, to prevent the slips or the falls in her home. So that was really just, you know, an example really of where the sort of works our technicians, when we're going into a home, they're not just looking at and putting a stair rail up. They're actually going in and looking at how that person, what other things might be that person need, and talking to them to see what help we can offer. Next slide, please. So during the sort of March last year to December, as a team of 16 people, we've got 8 technicians that go out carrying out works. We've carried out 4,600 jobs for people in their homes, essential jobs that have helped them to be safer or warmer or independent in the home. And really going back to one of Sue's slides where she talked about people, sort of the cost of falls in the home, we carried out sort of 2,557 falls prevention repairs. And even if a fraction of those people fell and ended up in A&E, the costs would far outweigh what it actually costs to deliver our services. So it really gives an example of the sort of work that can carried out, the help that can be carried out, but we are limited by the funds that we have to be able to deliver the works. Next slide, please. And really, this is just sort of the last slide on customer satisfaction. We've helped 60% of the people be safer in their own homes, and with 60% of those been, you know, saying that they feel more independent in the home. They're quite large percentages, and that all helps their mental health and well-being. So it really, the types of services that we're delivering are really key to certainly the older or vulnerable people, and really we could do with expanding further so that we can help more people. So that's really it. Thank you for listening to me.
Craig, that was terrific and remarkable figures, actually, in terms of the numbers of people you've helped. I mean, and the point you made about the numbers in relation to falls, I think was very compelling. So that was a really great insight, actually, into what your organisation is doing. Well, perhaps if I can encourage our other panelists to unlock their video screens, and we have had some a range of questions. Sue, I think you had one for Millie about a particular issue. Do you want to just raise that?
Yeah, I mean, you know, it was great to have the report about lived experience. I think we have to be very cautious with 20 people, especially all the points are made about north-south divide, the rich and the poor, ethnicity and all the rest. But I suppose the thing that really disappointed me was, why didn't you mention home improvement agencies? I mean, we've had 35 years of evidence documented research. And I think, as you heard from Craig's description there, Craig was doing exactly what those people want. And if it just felt like a bit of a sad missed opportunity, not to mention you've got an evidence-based solution here. Why not promote it? It's not the answer for everybody, but it's the answer for an awful lot.
Yeah, just briefly, Millie.
Sorry, so the purpose of that is because this output is one of many of the Good Home Inquiry, and other colleagues within Aging Better, we felt that this really was just to teach the lived experience, and the other outputs I didn't have time to go through later are going to be focusing on the importance of a good home agency. The cash work, basically the recommendations from that are we need to do more to promote good home agencies, and unfortunately that report isn't out yet, so that's why I didn't go through it today. And also our deliberative events, there again, their focus are going to be on developing the narrative around the good home agency. So it's not that it isn't the forefront of our mind, it is, it's just this report, the decision was taken just to focus on the lived experience, and then the solutions will come later as the outputs in the next few months. So that is the reason why.
That's good.
Yeah, there is a question as well about, sorry to interrupt, there is a question as well about, from your work, differences in terms of gender, ethnicity, and so on. And obviously, given the sample size, that may be difficult. But it may be a question for all the speakers, or one of you may want to comment. Ethnicity does seem to me extremely important from many reports in terms of, for example, pressures on South Asian community, poor quality housing, overcrowding, contributing to high rates of COVID-19. So that clearly is an area where we must have urgent action in many inner city areas. I don't know whether, Sue, you want to just comment on that issue.
Well, I'll just go back to data. The English Housing Survey sample size, because we looked at this in great detail when we did the analysis with CFAB and BRE, it doesn't actually enable statistically significant analysis based on the incidence of aspects of non-decent homes and ethnicity. I mean, put it really crudely, it doesn't show a difference because the numbers are so small.
Right.
Yes. But where local authorities have had a local house condition survey, then you will find a correlation. There's a very strong issue with particular ethnic groups and overcrowding. I mean, we've probably heard about that. But you've also got hugely different tenure profiles in different ethnic groups. And again, if you can mine that to a locality level, you'll tend to find that the certain groups who've got high levels of owner occupation will also have higher levels of non-decency. But you can't say this from the English Housing Survey, which is why we're always pushing for increasing that sample size so that we can actually do this. On the, I just want to mention gender. I evaluated Craig's handy person service. We did a very detailed analysis, and including the qualitative analysis. Now you've got this growing aging population of women living alone. I know there's now more men living alone, but you know, that age differential. And I interviewed, I think it was 8 of the people I interviewed about the handy person service and the value of having care and repair there. We're over 90, very capable, very happy in the home. But the impact of having a trustworthy person to turn to for practical housing services, and the shocking, I was shocked. I thought it wasn't shockable. I was shocked because every single woman I talked to had got a bad story about feeling threatened by a builder. Not in a, you know, nasty, it was like, you know, people saying, well, this is the bill. And you go, well, she said, I've done everything by the book and I've got a quote. And he said, yeah, but it's unforeseen works. What are you going to do about it? And, you know, basically sort of the I know where you live angle. And I think we shouldn't ignore that, you know, because if your target population for health is this older women on their own and feeling vulnerable, and because of dealing with builders and that sense of threat, I think the value of knowing they were there actually outweighed a lot of the practical values.
Yeah, no, I absolutely. Look, just before we finish, Erica Woods asked a very technical question. Is it true that VAT is charged on home repair materials, but no VAT on new build materials. Craig, what's your answer?
Right, yes, the simple question, yes, it is. Right.
Ah, right. Okay. Okay. Well, look, this has been a very, very powerful session for me. I mean, I've learned a huge amount, and I'm sure the audience has as well. I'm very grateful to the panelists, Sue, Millie, and Craig. And I should also mention Suzanne Booth, who's done a brilliant job organising us all. But I would like to thank everyone again. I do hope, I mean, MICRA has run a number of events on housing over the years with organisations in GM and as well as care and repair. So I hope, you know, we'll be running further events to keep this issue in the spotlight. So very grateful, Sue, very grateful, Millie, and Craig as well for your great contributions. And thanks also for everybody registering for the event. We do appreciate it and appreciate the support that you get. Okay, I think we will have to sign off now. Many thanks.